Hello, I'm so excited to talk to you today. It's been 10 days since my visit with Dr. Sharif, and I definitely would like to talk to you all about that visit with Dr. Sharif. It was wonderful and I learned so much information. But first, I'd also like to say that I am officially on the medication, which is 0.25 milligrams of dexamethasone, and by day 10, those swollen ankles again and feet are officially gone. So I'm very, very excited. In fact, I had a craft fair and I ran around the whole fair not once complaining of my ankles, not needing to sit down, not needing to put my feet up. It was a very exciting moment. So I would like to get back to Dr. Sharif's visit. When I went to see her, I had something that I was concerned about. It was my biggest concern for the whole visit, and that was the fact that with my blood results, my mutation is on one strand, which means if you think of a V and you have your mother's side and your father's side, only the father's side had the mutation. Now, this is where the dilemma occurs. The only text that is out there to date states that if you only have the mutation on one strand, or allele is what they say, that you are only said to be a carrier. Well, clearly that's not true, because some believe that it doesn't exist for the disease is considered recessive. Some say it doesn't exist to be a carrier or a dominant gene if the disease is recessive. So here's where it gets a little strange. Dr. Sharif has been working with patients like myself that only have that one mutation on one strand, and clearly she has seen that all of us have the disorder and have developed it and have had great relief and help with that 0.25 dexamethasone treatment that is used to treat a case where somebody has the mutation on both strands. So one of my fears was that maybe I wouldn't get treated, and that was quickly put to ease when she said, I see right here the way I look with that hump we had discussed about, the hair growth she checked out. Also, something I didn't mention that's an additional symptom are red dots on my upper arms, and she was the one who pointed out these red dots, and I've had them my whole life, and she said that's from insulin resistance, so which is also caused from all the testosterone, and having this genetic mutation causes these red dots along with everything we had discussed before. So the exciting part is she is treating me. She's a wonderful doctor, and 10 days later I've had such amazing results in such a short amount of time. Now, within the first 6 days I actually dropped 6 pounds. Since then I've leveled off, but that I think was 6 pounds of that excess fluid weight that I was holding. So I'm very excited again that already there are changes. One thing that's very interesting is I'm feeling a lot of activity in both ovaries. Not so much cramps, but movement and flutters and things that I remember only years and years of PCOS medication and when I went for in vitro fertilization. These are things that I remember from years ago that are starting to happen, and it's said that again after 3 months you may see finally an ovulation, a menstrual cycle, or it can take actually up to 2.5 years. I hope that that's not going to be the case, and somehow I'll fall between 3 months and a year. Maybe I'll start seeing the real changes within my body. So I will continue to update because this is so exciting. And to think, and this is what's really scary right now, I don't know how many women are getting tested for non-classical, But if they're getting tested and being told you're only a carrier and you do not have this, then they are being turned away by their doctors and not receiving treatment and not getting the relief like I've been getting just after a couple days. So this is a very serious issue, and we're talking millions of women worldwide. So it's definitely going to be an interesting journey, and I hope you stay with me. And if you're watching this and think it sounds like you, again, I encourage you to talk to your doctor and get that test. If for any reason your doctor is not willing to treat you because you're said to be only a carrier and the disorder is said to be only recessive, which again, clearly that's a mistake. I'm not a doctor. I would like to say that. I'm not a doctor, but I am a woman who has this disorder, and if somebody turned me away and said, you're only a carrier, then I'd be walking around right now with those horrible swollen ankles, and I would not have this feeling of hope. And I finally do have this feeling of hope. We have several links to Dr. Sharif's office. She has patients from around the world. So if you do get a diagnosis that you do have this disorder and your doctor is not giving you help, I really encourage you, please contact the office of Dr. Catherine Sharif. I would like to close with something that's very important. If you can actually go to our Get Help section of this website, and there will be the exact testing information, the brand name of the test and everything, that you can print out, and chances are, as I've been experiencing, your family doctor or whatever doctor you take this to is not going to be too familiar with this disorder. So please go right ahead and print out these tests and take that to your doctor so they can actually have something to reference.